Hello, everyone. I'm Dr. Mehwish Mubashar with you in another webinar, a live free webinar conducted for the students of MRCOG-1 by MedExam Expert. I'm sure you already know about the team, so I'm giving you a brief introduction. We have a lead mentor, Dr. Helmi. We have a senior mentor, Dr. Desiree, Dr. Rameshri, and I myself, Dr. Mehwish Mubashar. We are a team. We are the mentors, the team of mentors for MRCOG-1. And right now, we are organizing July regular course for July 2023 MRCOG-1 examination. So I'm telling you a bit about Dr. Helmi. Dr. Helmi is not only our lead mentor, he's also an examiner in RCOG, and he takes most of our live sessions. We have Dr. Desiree, a wonderful person, and she puts a lot of effort into the studies of students, and she takes biostatistics workshop, which is like an exclusive workshop for biostatistics, and she made this subject so easy for the students. The course students can definitely confirm this news that biostatistics is no more difficult after reading with Dr. Desiree, and also she takes microbiology. Dr. Ramya, she is so expert in anatomy that she delivered the anatomy subject just like a story, and it's very easy to understand and memorize the pelvis and the perineum, which is the main focus of anatomy in the MRCOG-1 subject. And I'm sure the students, when they attend the exam, they feel this thing that anatomy is a very easy subject for them after taking the live session with Dr. Ramya. And other than this, she takes the clinical management subject. I am the moderator of your study room also. I keep sharing the questions, I keep answering the queries of the students, and sometimes I love to work 24/7, and I try my best to answer the students as soon as possible. I also teach biochemistry and genetics in the live sessions. So this is a brief introduction of our MRCOG-1 team, and I'm sure the MRCOG-1 team from MedExam Expert is the best team ever. And as I'm a part of it, I can surely tell you that this is all you need for July 2023 examination. So why I'm giving you this introduction of the team and why we are here today? We are here today because students got panicked, they got disturbed by the news that RCOG is canceling September 2023 exam, and this year they are not conducting another exam. I'm sure it was a strategy of conducting more examination during the Corona years, and now they don't want to conduct another examination. So July and January is the previous schedule, and now they are following the same schedule in this year. So firstly, good luck students if you were appearing in the July exam and you were not sure that if you should take July or September. So I'm sure now students are sure that you are going to take the July exam, because the another attempt is quite late, and I'm sure no one should wait for a whole year to prepare for an exam, which you can take with a good preparation in only 2 to 3 months. So I'm seeing the candidates who have joined the session with me. We have Dr. Aisha, Dr. Rabia, Kalvanti, Zibun Nisa, and Farah Liaquat. We have Dr. Femi, Dr. Humera. Mostly our course students have joined, Dr. Nafia. So doctors, you can interact with me by the chat box. And other than that, you can just open the mic and you can talk anything you want to ask with me. So if there are any questions regarding anything, you can just tell me so we can start discussing the other contents of our session.
Hi, Assalamu alaikum, Dr. Mehwish. How are you? I'm Dr. Nafia.
I'm good, doctor. How are you?
I'm fine, alhamdulillah. Doctor, maybe just I need a query that I'm preparing first time MRCOG 1 exam, and maybe I joined
Okay.
maybe 20 days ago the course. So
Mm-hmm.
I'm really upset that whether I can be able to prepare for the July exam, or should I like take a attempt on the January? But do you think so? 4 months are enough? I am working 6 days and 9 hours daily. So how I will manage to prepare in 4 months? I need your suggestions.
Okay. So actually, this is the purpose we are gathered here, and this is the purpose we are attending this webinar today, because I want to tell you that attending July examination is not impossible for anyone. If you are working day and night, you can still take the examination by following the schedule. And if you are working one shift, then it's very easy for you to follow the schedule. If you are working like we doctors attend calls, 24 hours calls, so then again it's definitely possible for any students to take the July exam and pass it with a good score, because you have 4 months, and actually this is the game of 4 months only. If you are fresh graduate, if you are an old candidate, if you are repeating, for anyone, 4 months preparation, a dedicated preparation. I'm not saying you're just looking at the book and you're not studying actually. A dedicated preparation is very important. Dr. Fatma Hayat is asking, when is the self-assessment test physiology? Okay, Dr. Fatma, I would request you first to follow everything given in your study room, all the updates, all the announcement we do. And Dr. Desiree did an announcement yesterday, and she told you that physiology and endocrinology both have a lot of similar questions. And when you take the physiology test and you have not got enough knowledge from the endocrinology, it's difficult for you to answer them, and then you will get low score and then you will feel low. So we have decided to merge these two subjects together in just for the self-assessment or topic test, and then you will take two tests together. Okay, right after the session of endocrinology, you will be getting a topic test for both. Dr. Aisha is asking, Dr. Ashani. Okay. Dr. Ashani is asking, hi, Dr. Mehwish, I have submitted my eligibility on January, but I still didn't receive an email. Dr. Asha, if you can calculate the days, they take at least 40 days before replying. And if they have not 40 days or 4 weeks, I will tell you. Further in the webinar, I have given the detail. I think it's 4 weeks. So what they do, if sometimes they take more time than that, and if you have got an automatic response of your eligibility email, that means your application has been submitted by them, and they are just taking time for confirming the eligibility, nothing else. And if you have not got any automatic response, then there was some error in sending the email. So you should send another email inquiring about it, or else you can send the eligibility again. So let us start. What are the aims of today's discussion? We will briefly discuss introduction of MRCOG-1 examination. I will tell you how to start the preparation. If you are studying on your own or if you are studying with a group, I will tell you how to proceed with it. What are the areas of focus for MRCOG-1? This will be the point of discussion. I will tell you the timeline of your study, and I will discuss some strategies with you which you need to follow. Dr. Kalvanti, you can send the submission expression of interest today. Okay, you didn't get any automatic response. That means there was something faulty with the sending of this email. Probably you entered the wrong email address. In any case, you can take help from the MedExam team, or else you can send me the screenshot of your email and I can assess what address you entered. So I will guide you accordingly. I think you should submit it again. Okay. And make sure you enter the right email address. Dr. Zibunessa is saying, good morning. I'm in UK and have not completed lab. That means you are not done with both parts of lab. Probably this is the meaning. If you pass MRCOG-1, fortunately, you need to do lab. Okay. What I've got from this question, you are asking if you are done with MRCOG, then if you need PLAB or not. Okay, PLAB is another examination. This is like a registration to work in UK. Okay, but MRCOG is another examination, and you need it. Like this is a title, membership of of RCOG, Royal College of Obstetrician and Gynecology. So both exams are different, routes are different, syllabus is different. So you should not compare these two. When we talk about the of getting a job, yes, you can take job by after passing both of these exams. If you are done with all the parts of the PLAB, you need GMC registration. You need a GMC registration to work in the UK. And if you pass all parts of MRCOG, by as you should remember that there is a requirement of 4 years training, specialty training before part 3. So if you are done with all parts, then you can get the GMC registration, and then you can get the training post. So, doctor, I don't think that both are similar routes to and to get a job into UK. And I think PLAB is the easier one. It's the shorter one. So, if you are already taking PLAB, you are done with the part 1 of the PLAB. You should take part 2 and then GMC registration. But for MRCOG, I should guide you that you have to take all 3 parts, and then you have to get GMC registration, and for that you should have at least 4 years of specialty training. So if you're not done with part 1 of MRCOG, I'm not discouraging you. You should just pick up the books because it's a long process. There is MRCOG part 1, then 2, then 3, and you need this 4 years training before part 3. So go for part 1, pick up the books, set up the schedule like you are reading for the PLAB, and if PLAB is like closer, then go for it, and then you can get a seat in MRCOG 1 also. Good luck for both exams. I think both routes are equally important, but PLAB is the shorter one. So I'm giving you a brief introduction of MRCOG 1 examination. Thank you. And I have told you that it's especially for obstetricians and gynecologists. Okay. It's a specialty exam, like it's not a general examination like PLAB. So one thing which should come into your mind that if it's a specialty exam, it's more about obs gynae. It's less about surgery, it's less about medicine, it's less about dermatology. So if you are preparing for it, you should know that if you are doing the basics in the MRCOG 1, you should know that there are the basics of pregnancy, there are the basics of the, like if we talk about the anatomy, I've told you that anatomy mostly they ask questions from pelvis and the perineum. Okay, why they ask questions from the pelvis and the perineum? Because you are taking an exam which is only related to obs and gynae. Okay, and in obs and gynae, you know that we deal with a lot of pelvic surgeries and C sections, and anatomy is more and more about pelvis and the perineum part of the body. And if you keep learning about upper limb and lower limb, and you're learning about the thorax, then it is irrelevant and actually less important regarding this exam, because this is a specialty exam for the obs and gynae. So keep in mind, while you are preparing for it, you should have an idea that what you should read for it and what you should leave. Okay, and we call it orientation. And sometimes students are so not unaware so unaware of the syllabus. They keep reading a lot of unnecessary stuff, and they like waste their time in a lot of things which are not relevant to the course, and that's not a good practice. So always be oriented towards your syllabus. Okay, some doctor from Oppo phone is asking a question. Doctor, I would request you to just change your name and tell me your actual name, then I will answer your question. The second thing which you need to know about the MRCOG is like you will get a membership of RCOG, and membership exam and fellowship exam a bit different. The fellowship exam of RCOG is FRCOG, and the MRCOG is for the membership only. Okay, Dr. Usma Ishaq is here, and she is asking, is it enough time if we start now, like the mid of the Feb till July, and haven't studied till last 2 years? All right. When you are sitting in the exam and you are answering the question, nobody is gonna think that you are studying from 10 years or 2 months. So I'm telling you, I clearly said that you should not be sad about canceling the September exam. It's actually enough time. It's more than enough time for you to take the July attempt. And if you find it difficult and if you have no information about our MRCOG 1 exam, take this webinar. You can ask the questions with me directly, but also you can take educational help by our course, and you can join it today. And I'm sure you can pass the exam easily. Dr. Sumera is here with us, and she's saying, "Hi, ma'am. I have a long gap of studies. I need study partner with whom I can discuss one topic daily from group." Okay, can I be your partner, please? And I strictly discuss the topics in the group, so you have to follow your partner in the study room, and I'm sure then you don't need anyone else for your studies. Uh, and if you still want other partners, what you can do, you can make a post in the guide group. We have like 20,000 doctors in our guide group on the Facebook, and they are from different parts of the world, they are from different countries, and someone will be willing to discuss a topic with you daily. And actually it's a very good practice. I'm encouraging you to discuss the topics in the study room. Post a topic daily, I will be with you. We will discuss the questions and the topics. And it's a very healthy practice. In the post graduation examination, I encourage students to do the group study, interact, talk with your friends, talk about studies, talk about topics, and it's super easy to memorize things when you discuss them with your friends or the study partners. So Dr. Sidra is here and she's saying, what's the difference between fellowship and membership? Actually, Doctor, we are strictly talking about the membership exam, MRCOG 1. So I will not go into the details of the fellowship. And actually, it's like you after taking membership, you will go for it. So I will provide you the details of FRCOG. Like after this webinar, we can send you on your number. Dr. Uzma also needs a partner. Okay, Dr. Uzma got a partner. Glad to see that in our webinar, 2 doctors got the partners for their studies. So the step 1 of MRCOG, step 1 of becoming the MRCOG is MRCOG 1. Then you need to take MRCOG 2 without sending any evidence of your training in the OBS gynae specialty. And then you will take MRCOG 3. And for that, you require 4 years specialty training. So for the step 1, if you are working as a gynecologist, okay, well and good. And if you are a fresh graduate, it doesn't matter. You don't have to prove yourself that you are a specialist for OBS gynae unless you are taking MRCOG 3. So step 1 of MRCOG, if you are thinking about becoming an MRCOG, take the step 1 as soon as possible. Okay. So we have got no requirement for training for it. So now it's another question. What is the training for MRCOG? This is a very important thing to consider. Let me answer this query. Dr. Mona is asking, there is a message from RCOG that September exam cancelled. Yes, they have not messaged anyone. They have uploaded it on their official website. Okay, I'm not sure that they said that they will take September exam this year. I don't think, because it's clearly uploaded on their website that they are not taking September exam. So we were talking about the training which is required for MRCOG. Not required for MRCOG 1, not required for MRCOG 2, but for 3. So what is the training? You need to be a person who is working in the specialty. Okay, in every country the exams of OBS gynae are different. Like in Pakistan we take FCPS or MCPS, or we have this diploma in OBS gynae. So what happens, students keep asking, if we are working in the specialty but we are not trainees of our own country's examination. Like I'm a person who is not an FCPS trainee in the department, but I'm working in the department of OBS gynae that is dealing with all kinds of surgeries and all kinds of patients. So anyone who is working in the specialty and the duration of the work is 4 years, he can take MRCOG examination by showing his experience to the college before taking part 3. So this is the training. Whenever they say training, you should have an experience of 4 years of work in the specialty, and it's not necessarily required that you should be a trainee of your country's examination. And if you are a trainee and your training is 4 years, that's fine, that's good. But for those who are not trainees, the specialty experience is all they need. Okay, when it's required, I've told you before, part 3. Now we will talk about eligibility and expression of interest. So almost all the doctors who are sitting here with me in the webinar, they know about the eligibility, but some of them are confusing it with expression of interest. So I will simplify it for you, that expression of interest is something you are just giving, like you are telling RCOG that you are going to take July exam. That's it. This is a very simple form you will fill in. I will show you the form in the later section of this webinar. And what is eligibility? Eligibility is that RCOG is telling you that if you can take MRCOG or not. Okay. So expression of interest and eligibility are two different things, and both are required for taking MRCOG 1. So what I have said is, being eligible for exam is the eligibility, is the confirmation email, and expression of interest is from you to RCOG that you are going to take this particular attempt. And if you have got the eligibility, this is lifetime. And once you are eligible, you can take exam anytime. But the expression of interest, you have to submit anytime you want to take that exam. Like if I was thinking about the January exam and I sent an expression of interest for January, but now I have changed my mind and now I'm taking July exam. So what I will do, I will send the expression of interest again that I'm taking this July exam. Okay. All right. When you should book the exam? This is a very important question. When you should book the exam? Firstly, you have to follow the deadlines and the dates on the RCOG official website. Secondly, doctors, you should know that in coming 4 months, if you are able to study daily, I'm not saying 1 hour, 2 hour, 3 hour, but if you are able to study daily, if you do not have such health issues, and if you are not having anything, a job which is so much busy, which is so much engaging that you can't study daily, and if you have some family responsibilities which you can predict that they will affect you in coming 4 months, then you should not book the exam. But if you think that for the rest of the months you can study daily, 1 hour, 2 hour, 3 hour, doesn't matter, then you can take the exam. So this is very simple. Study daily and book the exam. So we have these 5 steps for booking the exam. You should keep in mind that firstly you have to make an account, you have to get a college number, and you will provide them an email. And this is a lifetime tip for you, that if you are if you are getting the college number from an email, use this email for the rest of the time. Once you have booked your account with an email, keep it with you, keep the password with you, keep the college number with you, because it will be same for the rest of the parts of the exam. Then you have to send the eligibility, you have to fill a form, and you will send it by attaching the picture of your degree also. Then you will send the expression of interest, of course, the dates you will follow, which are given on the website. And then you will book a place, you will provide the address, and then you will submit the fees. And for these steps, when the dates will be open for paying the fees, I will guide you, okay? So right now we are focusing more on sending the eligibility, getting the eligibility, and the expression of interest. So I have taken this screenshot from the RCOG official website so that we follow the exact and accurate information which is given about the eligibility. So they're saying to take in Part 1 MRCOG examination, you must be eligible. For new first-time candidates, this means submitting a complete eligibility application and having it approved. That means you should have a confirmation email with you. Reseat candidates are already eligible and do not need to complete another eligibility application. Okay. So I have taken the pictures of this eligibility application form. This is available on the website and you can download it. It has like everything you need to give them. You will fill it and then you will attach your degree, your medical degree with it, and you will send the eligibility. And what is the processing time? I've told you this is 4 weeks after the published closing date for your partner eligibility application to be processed. So if you're still waiting for your eligibility to be approved, that means the eligibility deadline is not closed for the July exam and they can take more time. And they are clearly saying that they will not accept late application. Okay. Now comes this very simple and short form. This is the expression of interest form. You can see you will put the account number first. And for that, you have to make an account on the RCOG website. We will open it and then you will make an account. You will sign up yourself and then you will get a college number. You have to put this email address and it should be same by which you have booked the account. Okay. Then you will provide your name and that's it. So first thing is that you are using the same number which is given by the RCOG to you and you are calling it college number. And this is very important to understand that the college number, you should not forget about the college number and you should not forget about the email by which you made the account. So this expression of interest, you have to submit a complete expression of interest form before the deadline. And after sending the expression of interest, you will book the exam. And I've told you that booking the exam now the exam is not paper based, it's actually computer based. And now RCOG have collaborated with Person Views test centers and they provide you an exam environment, they provide you centers. So you actually book the exam with Person View. You are taking exam with RCOG, but because they are giving you now online exams, they are not taking paper-based exams, so you have to book the exam by person view. And I've told you when the booking dates will be open, I will be providing you all the information regarding the booking. So the confusion is clear here. Dr. Mona was asking that if RCOG has notified Dr. Mona, this is the like screenshot from RCOG official website. This is an important update that they are not taking. They're not providing September 2003 examination. So after July, they are saying the next examination will be January 2024. And these are the deadlines. These are the deadlines. So eligibility deadline for the July exam is Monday, 6 March. Expression of interest, you can send it now, but it will be closed on 16th March. Then the booking window will be open from 27th April 2023 and it will be closed on 9th June. And exam date is 4 July. So the important point of discussion today is that should you cancel July exam or not? So candidates, after reading the title of the today's webinar, you are here. So you tell me, are you thinking about canceling the July exam? And what are the factors which you think that affecting your preparation? And what do you think? Like if I'm here, I want to take an exam, and I keep thinking that if I get like 2 to 3 hours for study every day, I will take the exam. So what are the factors which are making you think that you should not take July exam? Please discuss. You can use the chat box for the discussion, or else you can just put on the mic. Okay, I have got a direct message. Doctor is saying that I'm not sure about my preparation. Okay, you are not sure about your preparation. And let me help you. How can you be sure about your preparation? You can solve mock examinations, but for solving mock, you have to prepare first. Um, Let me show you this thing. If you know about this structure, if you know about this division of the subject, if you know about the structure of the examination, it's very clear that you have to work on the data interpretation, anatomy, endocrinology, physiology, pharmacology, and pathology. So if these 6 to 7 subjects you are working on, and you think like in 4 to 5 months in these major subjects you can work on, and then we have these minor subjects from which 10 to 12 or 8 to 10 questions are coming. So keep in mind that you should be very oriented. You should be very oriented. You should know from what subject how many questions are coming, and you should be very much sure that you are able to spend time on the study. And after that, it's not difficult. It's not difficult for you to pass the exam. To pass the July exam, it's very important that you should aware of your of your efforts which you can take for the exam, and you should be aware of the exact sources or the exact division of the subject. And like you should be very oriented before finalizing that you are taking exam or not. Dr. Nafia is very much sure. She's saying inshallah, hopefully I will take the July exam. Very good. Inshallah, hope we are with you. Dr. Labika is saying inshallah she will take the exam. Very good. Dr. Sana, should we read MRCOG-1 basic subjects books or not? Dr. Sana, for our course students, it's not necessary. It's not necessary that they would read the books for the course, because in the course they are provided with everything they need. But the ones who are studying on their own, they have to read some good theory books and make sure you have the updated knowledge, because books are old and they have only one edition, and they have not updated the information. So you should be very much sure that you are reading the things from an updated source. Dr. Nafia is afraid of data interpretation. Why you are afraid of data interpretation, doctor? We are not done with this yet, so I would say just wait for the live session. And we have covered the physiology, and now you are not afraid of the physiology. Just like that, you will be covering all the subjects, and I'm hopeful that you will be preparing all the subjects very well. Dr. Femi is asking how to access the MOOCs for the personal study. Okay, the mock exam is actually present on the website. For the course students, we open the mock at a right time when it is useful to take a mock. When it's useful to take a mock after subject-wise preparation, because before that, if you take the mock, you will definitely get not get the good score. So, firstly, go for the subject-wise preparation. Then we will open the free mock test for the course students, and if you still want to take the mock exam, you can contact the team, and they will tell you how to take the mock exam on the website. Opportunities just don't happen, you create them. Okay, this is a wonderful quotation I got, and sometimes I totally believe that some things, like it's if we're talking about July exam, and you are thinking about it only, and you are not doing any efforts for succeeding in it, so this is like you are missing an opportunity. So you have to create it for you. If you want to pass the part 1 MRCOG, you have to create this opportunity, you have to book it, you have to prepare for it, and then you will take it. And med exam team is with you in all the steps. Okay, Dr. Sidra is saying, I'm an infant and have to manage my home. I'm not doing training anywhere. Thus, I feel I'm away from the field. Okay. And Dr. Sidra, I would say just join the study room so that you don't feel lonely while studying. You will be having like 200 people around you studying, and you will be feeling totally motivated. And we have assigned study tasks to the students. And if you're sitting at home, that doesn't mean you can't study and you can't feel the environment of a study room. You can just pick up the phone and join the study room, and this is all you need. Okay. A doctor from iPhone is saying, Inshallah, I will be taking the exam in July. Okay, good luck. I'm happy for you. But should we be reading the revision notebook or PDF and live session is enough? Okay, okay, totally enough. The live sessions and study room questions and the material we have provided on the website is totally enough to pass the exam. And I'm sure, our website have got quality material for the study. The team of mentors I've showed you, we all are working on the materials. We all are working on getting updated information. We are working on the past papers files. We are working on the live sessions so much. Like sometimes we we do the meetings and we keep talking about it. And I tell them like today I was working on a file for 5 to 6 hours. Dr. Desiree was saying I worked on this past paper file for 10 days. So you are getting most updated and most quality material on the MedExam website, and this is our aim to make the website so like knowledgeable and complete so that you don't have to subscribe to any other SPS sources and you don't have to buy the books once you have entered into the course. This is all you need. Okay. And Dr. Sidra, you shared your life story with us. I'm sure you are a great person who is thinking about taking an exam. So don't think that with an infant and with the household responsibilities, you are not able to clear the exam. You are just a great person. You must be very hardworking because you are doing a lot already, and you are thinking about adding more hard work into your life. So I appreciate you, and I say you good luck because I love hardworking people. So this is a planning. This is the planning chart for you. But how you can take the July MRCOG-1 examination, how it's possible to take it and not failing it. So firstly, make a study plan. It should be 4 months, and you already have 4 months. Know about the syllabus. The specific syllabus for MRCOG-1 is available on the MRCOG website, but if you are unable to understand it, you can just take the help from the mentors. Know about the sources. I have seen students subscribing unnecessary and way difficult and way irrelevant sources for SBS that I feel that why they are wasting money and time on them. So do not pile up the books at your home. Do not buy a lot of books and do not subscribe for unnecessary sources. I know there are good ones, but there are bad ones also. Okay, so always be very wise while spending the money on unnecessary books or subscribing for unnecessary like courses and sources. So what is the strategy here? You should only follow one platform for the study. Like I'm saying, for our course students, they do not need to join other study rooms. They do not go for buying unnecessary books. They should not go for subscribing like online SBS sources because we are giving everything, all the important points, all the past papers, all the important materials in your website, in your study room. So why would you spend money on other things? So only follow one platform and practice daily. Like if you are able to study daily, I'm not saying 1 hour, 2 hour, 3 hour. I'm saying daily. So this consistency will be mattering a lot. So your daily hard work is everything you need for taking the exam. Dr. Alina is saying which ones are authentic sources for those who are doing self study. Dr. Alina, it's like a bad news that we have not got updated sources for MRCOG-1. I don't know the reason, but they have not upgraded. They are not giving the updated versions of their books. Why? I don't know. We have a very authentic book, Oxford Revision Notes, but it's an old one. And now you know that a lot of researches, a lot of new guidelines, we are here dealing with a lot of new guidelines. We are daily getting some updates of the guidelines. But in the book, they follow only the old guideline because that's from 2011. So in 2011, that information was correct, but not today. like 2011. It's been more than 10 to 11 years. So we don't have any choice because they have not updated. What we can do, we can read the updated guidelines. But for a person who is taking MRCOG-1, it's definitely not possible for that person to follow all the important and updated guidelines, and he must be unaware of the sources which he needs to follow. So what we do, we help students in this case. We provide them all the updated materials. Okay, so I would say that self study is somehow not safe. If you are reading old books, you have no information about the updated guidelines. So please take help from the mentors. I have this timeline which our course students are following. So in the December and January, we provided them recorded sessions. And the thing I'm focusing on, this consistency, I made them study daily. They were solving only 5 to 6 questions. They were playing only 1 hour recorded session, but they were studying daily. So the consistency building thing was already done, and now students are taking live sessions. And this is the subject wise preparation. Subject wise means you are doing everything from the physiology, then endocrinology, then anatomy, then genetics, and so on. Okay. So in February, March, April, and May, we will complete all the subjects and past papers. And the aim of this phase is the concept building for all the subjects. Okay. Then we have this revision month, which is June. In the revision month, we have a progressive course in which we will revise all the questions, all the materials. And then we have this 5 days workshop, which is so promising that students sometimes say that from the workshop, they get 60 to 80 questions directly. Why the workshop is not like we are leaking the questions. Workshop is like all about revising everything in 5 days right before the exam, and it's very useful. In the July, you will take the exam, and I'm sure you all will pass this. So Dr. Aman is here. She's saying, is this exam doable if one is preparing for other exams like FCPS or PLAB? Why not? Why not? You only have to plan the exams wisely. Like if you are saying on the 4th July, I'm taking MRCOG-1, and on the 5th July, I'm taking PLAB. That's not possible to do clear and prepare for both of them. Maybe in the whole world, some people, like 5 to 6 people, have such examples, but it's not like applicable for everyone. Like if I'm a person, I'm a normal person with an average like IQ, so I'm not able to prepare for two different exams at the same time. So like 2 to 3 months, your timeline should be like this. If you are taking exam in the July, the MRCOG, the other exam should be September or October. 2 to 3 months for last 2 to 3 months for the revision of an exam are very important. Dr. Sana, the December and January sessions are recorded and they are available on the website. Nobody attended them because these are recorded sessions, and the recordings are available for all of you. And another thing, you should not panic about the recorded session. If you have got the physiology recording sessions, what you can do them during the days, like we have assigned 10 days to the physiology, and during these 10 days, you can play the recorded sessions also. So I would say do not delay the July exam, go for it, and do not think that exam is difficult, especially if you're a course student. You should not be worried about the difficulty of the exam because it's very easy. It's very doable with the help of the mentors. We have wonderful team. We have wonderful team full of dedication, and we keep motivating the students. We keep correcting their mistakes, and we keep telling them that where you should put the efforts and where you should not, because I remember a person, and she was panicking a lot from the subjects biostatistics. And when I told her that from the biostatistics, you are only getting this is the biophysics, yeah, this one. So epidemiology and stats, you will only get 10 to 12 questions, and out of those 10 to 12, there will be like 3 to 4 questions, which will be about the calculations. And we have another mentor, Dr. Mariam, and she has taken the exam in September. And she was telling me that there were only two questions related to calculations. And for those two questions, I will say you should not panic. So you should know where to spend your time, where to spend the efforts. And in the course, we keep telling students, we keep guiding students that do not worry about the subjects which are minor. Study them because each question is important. All 200 questions are important, but that doesn't mean if you are worrying a lot about biostatistics and biophysics and you are leaving behind the anatomy, that's not a wise practice. So believe in yourself and join our best study platform because this is something very promising. So it's done from my side. I've given you all the important information regarding exam. I've told you that if the September exam has been cancelled, you should not worry about it because what's happening, we are doing a lot of effort for the July exam, and you can exactly clear it by what you are studying daily and you are taking help from the mentors. You only have to follow this formula: study daily, take the help from the mentors. That's it. You need just two things for passing the exam. So doctors, if you have any queries regarding exam, regarding today's topics of the discussion, you can tell me. And um, question pattern you want to see. Okay. I have shared this question pattern in the study room as well, Dr. Humera. Thank you, Dr. Nafia. Thank you. And Dr. Sidra, if you can just take my number from the MedExam team, you please discuss your situation. I think you need more help because you are sitting at home, you're not practicing anywhere. I think you need more help. So I will guide you personally that how you will handle the household chores because I'm also one who is not like doing such very hard, like very engaging and busy kind of job. I practice in the clinic and I take care of my babies. I cook for the family and I study also. So I will guide you how to manage everything. Okay. Thank you, Dr. Raymond, Dr. Mona, Dr. Ashani. Thank you so much. Dr. Zebinusa, thank you. Thank you, Dr. Labika. Yes, Dr. Fatma has given the contact number of MedExam team for all of you who want to contact for any query. Okay, Dr. Kalvanti. Yes, Dr. Sidha, I'm very hopeful that you will take the July exam and I'm totally here to help you. Happy Friday. Yes, a lot of prayers for all the students. Thank you so much for attending the webinar. If there are no more queries. Yes, yes. Dr. Sudan, it will be recorded and it will be with you on the YouTube after 24 hours. Thank you, Dr. Humera. Okay, bye-bye. Allah Hafiz.